Joining us now is Dr. Kester Nedd, a neurologist from JIPA Network. Dr. Nedd is a board-certified neurologist with extensive experience in neurorehabilitation, traumatic brain injury, and international healthcare coordination.
Good afternoon.
Thank you so very much for joining us this afternoon. It's a very special recognition going on today. So we'd like you to tell us a little bit more about the JIPA Network.
Afternoon to your audience. And the JIPA Network is a group of healthcare providers between the Caribbean, Latin America, and the USA who've come together since 2010 to help Caribbean people get access to complex healthcare when it's not available in their region. Now, we also work with hospitals in Jamaica, hospitals in Trinidad and other Caribbean islands to bring patients to when they come from other islands where the services are not available. Understanding that we are small nations with small populations, so it's not cost effective to offer some of the more advanced, what we call tertiary services. So our company, we help patients get access. So we get calls from doctors, from insurance companies, from patients, from corporations. When you get yourself in a situation where you have these catastrophic healthcare needs, we coordinate those services for patients.
All right. Thank you for the clarification. Now, can you tell us what type of abuse do elderly patients or elderly persons experience with their healthcare?
My background is as a neuroscientist. I'm a neurologist. So I am involved in caring for people with injuries and also illnesses that come towards the end of life, very commonly. And as you know, we live in a world where we have a growing elderly population, less people born in many countries, and more people live to be in their 80s and 90s compared to 20, 30 years ago. So as a result, society is faced with this problem of how do we care for and manage people in their advanced years. Therefore, for those demographic reasons, more and more people are requiring services in order to support them in those years. Of course, in many cases, those persons might have assets, or they may be in a situation where they can provide for themselves and either a family member, a friend, and in fact, some people don't have any living relative at that age. So they're in a very vulnerable position requiring the services of others. And elder abuse could occur in many ways. It could be from a family member, it could be from an institution who's providing care, it could be from a relative, it could be from a spouse, from a business partner, in terms of others taking advantage of that person. It could be on an economic basis from their finances, also sometimes on just physical abuse, emotional abuse. All of those constitute a form of trauma to the elderly in these times. So clearly there is a need for us to become more aware of these problems.
Absolutely. And what advice would the JIPA Network give to older Jamaicans and their families about planning for health and financial security?
Well, that's a critical point that all of us are going to get to in our lifetimes. And first of all is to understand the process of aging and understand what changes do take place. Finding support and family members. Some people have to go through the legal system in order to secure their own future and appoint what we call guardian, people that would professionally be responsible for taking care of them medically, their assets, and so forth. Be sure that your family members are set up in a way that they don't take advantage of your assets, so they don't exploit those assets before you die.
Absolutely.
And that there is enough of those assets left to take care of. And of course, the whole issue of personal violence, because people in that age group might not be compliant, they may be confused, disoriented. Others sometimes take advantage of those situations. And believe it or not, it's really stressful taking care of an elderly parent or grandparent simply because they may not be as compliant in the ways that you might want them to. And it may be inconvenient to take care of them. And usually it's at a time when you have kids or you're taking care of your own kids or other family members, and the time that's required between work and free time for yourself is limited, and therefore you have to respond to the needs of those persons. Oftentimes, people lose their patience, their temper, and so forth because they fail to understand the nature of how people behave when they get to that stage. Critically important is understanding those facts
Yes.
and preparing for when and if you get to that stage.
Thank you very much, Dr. Kester Nedd, neurologist from JIPA Network. Thank you so much for joining us and sharing these valuable insights.
JIPA Network, your connection to affordable global healthcare.